Hi, and welcome to DIY Breastfeeding. My name is Robin Kaplan. I'm an international board certified lactation consultant, owner of the San Diego Breastfeeding Center, and host of the Boob Group podcast. And today we are talking about some common concerns that moms might deal with while breastfeeding. Today specifically, we're talking about plug ducts. So, what is a plug duct? I get this question all of the time. And essentially what it is, it's a little plugged area. Might feel like a little pea or a knot inside your breast, or it's actually a decent sized area that's really, really tight and uncomfortable, sensitive to the touch. And you might find that that breast is actually producing less milk than what you're used to getting out either with the baby or with the pump. So what can cause plug ducts? Tight latch. So if a baby is compressing mom's nipple, essentially it's kind of temporarily blocking the exit route of that milk, and so it kind of backs up into the breast, which goes along with ineffective milk removal. So either baby's not breastfeeding well, mom has an oversupply, and so baby's unable to drain the breast as well as maybe she needs it to be, or she's relying on an ineffective pump. So the pump's on there, but not really doing much to get that milk out. Sometimes plug ducts can happen because your sweet little baby decides to sleep a little bit longer than he or she you're used to. And so you wake up and you find that there is an area of your breast that feels tight and tender to the touch. Exhaustion and a lower immune system can also lead to plug ducts, so it's not uncommon for moms to get them within the first 2 weeks, or as well as when baby's going through a growth spurt. So mom's feeling a little bit run down, and her body's just having a little bit of a harder time getting that milk out because of some inflammation that she's dealing with. When we're stressed, we have higher inflammation, unfortunately. Or we could get a plug duct from a milk blister. So that little pimple that you may find at the tip of your nipple, essentially what it's doing is blocking the exit route. So the milk tries to come down, it has no way of getting out, so it backs up along that milk duct and causes that area to be tight and tender. So how do we prevent this from happening? Making sure that your breasts are softer after your baby feeds or after you pump. You can massage your breast while the baby is breastfeeding or while you're pumping to help move that milk from the back part of your breast out towards the nipple. Making sure that your baby has a really deep latch. Remember, we don't nipple feed, we breastfeed. And so the wider your baby's latch is, the more that suction is going to be able to pull that milk out. And make sure that your baby isn't pinching your nipple. And if your baby is an ineffective breastfeeder due to a tongue tie or lip tie or prematurity or any other types of feeding challenges, getting the help from a lactation consultant can make sure that you can protect your milk supply as well as help your baby to become a more effective and comfortable breastfeeder. So if you are dealing with plug ducts, what is the treatment? It's actually pretty simple. So drinking lots of water, helping to reduce that inflammation, flushing out your body, cold compresses in between feeding. So think of your breast like a swollen ankle. So cold helps reduce the swelling, and then right before you feed, taking a warm face cloth and putting it over your breast to help open up the milk ducts and blood vessels and help your milk to come out. Another thing that can be helpful is a castor oil compress. So castor oil helps break up blockages below the skin. We don't want to take it orally because it causes wicked diarrhea, which is pretty nasty. But if you put some on either a wool cloth or a face cloth, heat it up in the microwave for about 15 seconds, make sure it's not too hot to the touch, and placing it over that plug duct. You keep it there for about 20 minutes, take it off, repeat, take it off, and it can help break up that blockage. Make sure though, if you're ever using castor oil, it does stain, so you don't want to sit on like your favorite couch without a towel behind you, as well as you really need to wipe it off, wash it off with warm soapy water, because we don't want your baby to ingest it at all. That's very uncomfortable for a baby to taste, as well as the bad diarrhea that I've already mentioned. And another thing you can do is actually dangle feeding. So if your baby, you lay your baby on his or her back, you get on all fours, lean over your baby, and have gravity help kind of pull that plug duct out. That can actually, or that plugged area can actually be very helpful. So some moms actually deal with persistent plug ducts, and that's a little bit different. At that point, you want to see why is this occurring, because that's actually not normal to continually be backing up. But for moms who deal with persistent plug ducts, taking a daily non-GMO soy lecithin or sunflower lecithin capsule, it's 1,200 milligrams 4 times a day, for about a month. What lecithin does is it keeps things from sticking together. And so what it does is it makes your milk duct slippery and helps get that milk out, so that can be really helpful. Omega-3 vitamins can be great too because they reduce inflammation. Sometimes moms will actually do therapeutic ultrasound. We have some information on this on our website and as well as on our podcasts, where ultrasound is done to that area to break up the blockage. And some women find that acupuncture and Chinese herbs can be helpful, as well as sometimes if it's being caused by inflammation, even trying a gluten-free diet can be helpful as well. So those are for the persistent plug ducts. So hopefully you learned everything you wanted to know about plug ducts and persistent plug ducts. If you would like to watch more videos like this, please make sure to subscribe to our DIY Breastfeeding YouTube channel, as well as you can always check out more of our articles and podcasts at both the San Diego Breastfeeding Center website as well as New Mommy Media's website. Thanks so much for watching DIY Breastfeeding.